Hey guys, happy Friday. Nikki here.
Hey, it's Kim. How are you?
Happy New Year. We just wanted to join you today and talk biostimulators, the wave of the future.
What's your favorite biostim procedure?
My favorite biostim is PRF in the under eyes.
When I've tortured you with that before.
Yes, and also in my scalp.
Uh-huh.
I will be very honest, I've had significant hair loss from my weight loss with ʟɪᴏᴏᴏ. It's a side effect. It happens. And Kim tortured me with, injecting my scalp, but it was pretty bad. We should show everyone the picture of myself.
How do you feel about the results?
I literally have done it once, and I for sure see a difference.
Really?
Like 100%. Yeah.
So that's what I need next.
Yes,
Okay.
that, and then also my under eyes. You've done my under eyes like 3 times now, and I feel like I don't look as sunken in like a tired mom. So
What did you feel like the recovery was like for the under eye PRF?
really super easy. You have some swelling under your eyes, like kind of look like little balloons, but honestly, we give out blue light glasses and it totally hides the little mounds. And then I was swollen like maybe 2 or 3 days.
Sounds like a good procedure.
Yeah, and the most important thing is we don't want you to take ibuprofen. We don't want you to ice it. We want that inflammation there so that, you're getting as much stimulation as possible of your inflammatory response.
Absolutely.
Yeah.
I also really like Sculptra. That's probably one of my favorite procedures. So Sculptra is basically dissolvable suture material that gets ground down, liquefied, and we inject it into areas where we're trying to increase collagen and elastin. You've been doing my Sculptra, and I'm going to do my Sculptra today.
Stay tuned.
Yeah. And it's definitely something that we think of as an investment in your future self, like your 401k. You're not going to see the immediate results, but over time, you're going to slowly, gradually build that collagen, and you're going to look better than everyone that's the same age as you.
Yeah, it definitely shows in pictures. I feel like a lot of our women will be like, oh, I was on vacation and came back and could not believe how well I looked in my photos.
Yeah,
so
absolutely. It's nice too because not only does it help with collagen and elastin, but it also helps with skin glow too. So textural issues, some of our patients that have issues with like acne scarring, fine lines, it helps revolumize those areas, and it just is a wonderful procedure.
And we love filler. We both love filler. We've had filler, but a lot of women and men are scared of filler, which, we don't want there to be a big bad stigma with filler, but sometimes celebrity life and, like certain people who have overfilled, it scares people, but this is such a good alternative to get all of those benefits and not have to go the filler route. And like Kim said, it's dissolvable suture material. So it's the same things you would get like if you had to have surgery or a cut repaired in the ER. It's very natural and, organic.
Yep, absolutely. Yeah. It's going to help you age gracefully over time. What are some other procedures that you really like that help with collagen?
So, not necessarily a biostimulator, but everyone here knows my absolute favorite procedure is microneedling. Super easy procedure with very little downtime, maybe about a day. You look pretty red, and I love to do my face and neck, but it superficially creates wound injury with needles. It sounds worse than it is, but we numb your face. It's very comfortable. And it superficially creates wound injury and tricks your body into thinking it needs to heal, and you have incredible cell turnover. So it helps with fine lines, pore size, and again, it's just one of my favorite. And I always say, don't neglect your neck. So I always
you don't want to be a floating head. Don't be a floating head.
And your neck shows your age. So if you skip that, it's not gonna work.
Do you like to add PRP or PRF when you're doing microneedling?
Yes. So I've had it injected, but I've also had it where they use that as the surfactant all over my face. So as they're, making those little wound injuries, we're at the same time injecting my own plasma for extra growth factors. So it's, you're kind of getting...
You're amplifying the results. Yeah, You're seeing so much more with that.
Yes.
Yeah. One of my favorite procedures is the CO2 laser.
Yes, she's a trooper and has had it twice.
I've had it twice, performed it many times, but that is definitely a phenomenal procedure. If you can tolerate the downtime, you do look like a burn victim. I find that the procedure itself, it's a little bit spicy. We do numb you significantly. For me, I only had to take ibuprofen afterwards. We were given prescriptions for pain medication and things to help sleep, but I tolerated it just fine with ibuprofen. And I found that the results were phenomenal.
The results were wild. We should actually do like a quick show of it.
Yeah. What areas of Biostim can be used? Can you use them on the body? Okay, that's a good question, Chrissy. So other areas that we can do with Biostim, well, microneedling is a great procedure that you can use on any area that you're seeing a little bit of laxity or textural issues. I actually was debating doing some microneedling on my abdomen. I found that after pregnancy, I've noticed just a little bit of laxity in the skin from being stretched out from my 3 beautiful children. The gift of motherhood.
Yeah.
But would like to tighten that up, and that's definitely something that you could try.
And you've done my knee. Kin has injected my knee with PRF as well as microneedled it. I have like a really annoying childhood scar that I'm dramatic and it haunts me when I wear shorts. It haunts me when I wear shorts, but we've done it there and that's been incredible. And like I said, the microneedling on the neck and the chest shows really great results, especially like if you're someone who sits at the computer all day and you're stuck with tech neck.
Yeah. That's
one of my other favorite spots to microneedle.
Yeah. Or even if you're a side sleeper and you find that you're getting those lines from your breasts, your décolleté, that's another area to consider because that definitely ages you, especially like if you're in a tank top or in a bathing suit. You know, you don't want to have this glowing, beautiful face and then your neck looks kind of
like you said,
aged. Yeah, you don't want to be a floating head. Don't do it. It's not a good look.
Sculpture too, we've done in the buttocks for people with like, the dimpling, or they just need collagen stimulation in the, what are they called?
I don't know, but if you have a pancake butt, you can do sculpture there too. But
when you get those girls get those little divots, I forget what they're called. No, it's like
hip dips.
Hip dips.
Hip dips.
I don't know why I couldn't think of that.
Yeah.
We all hate hip dips, but that's awesome for sculpture.
Yeah.
Great location.
And it's nice because, you're not having to go under the knife and no one's really knowing what you're doing. It's a gradual, slow build, so no one's really going to call you on it. Whereas if you're doing something surgical, you're going to have to take out time and you're going to be away from work and you're going to have, post-operative challenges. This is pretty easy. You go back to work that day.
Yeah.
And you can go and get your butt lift on lunch.
Yeah.
I mean, truly.
You might have like a slight bruise, like you don't have to worry about it on your butt, but if you get it on the face and or if you do microneedling on the neck, obviously in the face, you're gonna have a little bit of downtime, but nothing crazy where someone's gonna call you out, like Kim said.
Yep, absolutely. Are there any risks with Biostim?
That's a good question. Sculptra, maybe.
Sculptra, we said, can sometimes, rarely see a granuloma. That's something that I've come across maybe once or twice in my career. Luckily, we do have medications that can help bring that down over time.
We'll use a steroid.
We can inject 5-FU, but it's not something that's permanent. A lot of times, patients will come in and they say that they feel a lump or a bump sometimes from the steroid or from the Sculptra, but if it's not visible, we don't always treat it because that volume is serving a purpose. It's giving you volume, it's creating a nice aesthetic outcome. If it's not suiting your aesthetic needs and that you're seeing it visually, then we will address it and try and bring that down for you. So.
And I feel like one thing to explain about Sculptra, just like how Kim said, it's dissolvable suture material made into a liquid. So it is very thick and sticky. We have to make it a very specific way. So one of the most important things for patients to know if you're deciding to get Sculptra is the first 5 days after you get it, before you leave, we're going to teach you how to massage your face or whichever area you had it, because you want to keep that Sculptra evenly distributed where we injected it. And, the 5 days is sufficient enough, but that will help it from clumping together and potentially forming one of those little nodules or granulomas. So it's something to know that you have a little bit of homework after you get it.
Yeah. Okay. Are there any risk factors with PRF? So, any type of injectable, there's always the risk of bruising. I really have not seen a ton of bad outcomes with PRF. One thing that I can report is that I had one patient that sustained a bruise, and she had a hemosiderin reaction where the skin kind of turned a little bit darker. But we're able to get rid of that with IPL. It's not something that you deal with permanently, and that's really rare.
Got rid of it with our dark correcting cream.
Even correct?
And she didn't even need IPL. Yeah, so
amazing.
If that, it's super rare.
So rare. I mean, I think we've been injecting PRF on each other, on patients for years now. I've seen it maybe once.
Yeah. And you get your blood drawn from your arm, so there's a risk of a bruise there as well. Maybe a little bit of discomfort, but overall it's, again, something else people love because it's completely organic.
It's a really benign procedure and has a lot of long-term gains and rewards from that. So, ending statement and goodbye. Apparently we're getting kicked off. It was so fun chatting with you. We hope that this video was really helpful and that you learned something.
With you are my favorite.
I love Fridays.
Me too.
Okay.
Yeah.
Thanks, guys. Have a good one.
Bye.
Bye.